Hello there, listeners. It's Susie No here from the Australian Society of Anaesthetists, and thank you for listening to our podcast. It's called Australian Anaesthesia, and this is episode 12 of a little series that we have called Talking Money, where we do more than talk money. We discuss the professional, economic and business aspects of running an anaesthetic practice in Australia, because we understand that you went to med school to learn how to become a doctor, and that learning how to run a business may have been the last thing on your mind. Our goal in sharing with you this information is so that you can focus on the important task of caring for your patients, knowing that the business aspects of your practice are being conducted in a way that is safe and lawful, and once again, for this episode, that are compliant with Medicare. We've been getting a few queries lately about how to use the telehealth item numbers, or what you can do in terms of billing for preoperative assessments that are being conducted over telephone calls. Before I launch into answering this question, there are quite a few episodes already about the anaesthesia consultation item numbers, and there will be more coming. But if I can for a moment direct you to the website of the Australian Society of Anaesthetists, that's where you'll find all of these episodes in full. And the address for that website is asa.org.au. If you go to the education tab, then follow the links from the podcast tab to find the Talking Money series. In that series, my most recent episode, which is Talking Money, episode number 11, I chat with Dr. Andrew Mulcahy, who is an expert on all things MBS, and we take a broad view of the anaesthesia consultation item numbers. I also, in Talking Money, episode 8, take a deeper dive into 17615, which is an example of one of the longer item numbers, and give you some tips there on how to use that item number again so that you are compliant. And also some extra tips in case you ever do get audited about the use of that item number in the future. And before I go into talking about telehealth, let me reiterate that the Australian Society of Anaesthetists encourages appropriate pre-anaesthetic consultations prior to all anaesthetic services. It's not just because you can bill for them, it's because it's good medicine. And that's been shown time again in coroner's reports and mortality and morbidity findings that good pre-anaesthetic consultation contributes to patient safety, whether it's conducted face-to-face, as an outpatient, as an inpatient, via telephone or via telehealth. It's an important opportunity for us to meet our patients, assess their risk and explain the anaesthetic. So for those of you who are not an ASA member, unfortunately I am going to leave you here. Thank you for listening so far. The rest of this podcast is for members only.
Thank you for listening to the Australian Anaesthesia podcast, which can be found on all the major podcast hosting platforms, as well as YouTube. This podcast is produced by the Australian Society of Anaesthetists and hosted by Dr. Susie No, with music created by Dr. Mark Seuss. The ASA was formed in 1934, and our vision is for every anaesthetist in Australia to be at their best, providing the highest quality anaesthesia and perioperative care through excellent technical and non-technical skills. We also hope that this means that you are functioning at your best when you're away from work. In this podcast, we have conversations that seek to inform, challenge, and inspire you to keep you performing at your best. Members of the ASA can access full versions of all episodes by logging into the ASA website at asa.org.au. If you are listening on your favourite podcast app, then make sure you look at the episode notes for the direct link to the podcast on the ASA website. Also, feel free to follow or subscribe so that you can receive the latest episodes as we do publish regularly. If you have any questions or feedback, please feel free to email us on podcast@asa.org.au. Thank you for your time, and we hope you enjoyed listening.